We really appreciate everyone joining us today for this important conversation. And we are really pleased to bring this webinar to everyone today as a reminder of how important our collective action is for supporting the world's most vulnerable. And today we're going to bring you directly to the front lines of one of the largest refugee responses in recent history. In August 2017, hundreds of thousands of Rohingya fled violence in Myanmar, and they crossed into Cox's Bazar, Bangladesh, creating the world's largest refugee settlement almost overnight. Entire communities of over 750,000 people arrived with little more than what they could carry. The scale and speed of the influx was staggering, and the humanitarian response has had to match that urgency. BRAC had no prior humanitarian large-scale response experience, yet drawing on decades of work in development and poverty alleviation, our staff mobilized within days. Hundreds of our staff arrived from across Bangladesh, simply showing up where they were needed. From those early improvised beginnings, BRAC has become the single largest civil society responder in the camps today. This is the essence of BRAC, always finding a way to bring dignity and resilience to the people we serve.
आरा बर्मात आयदे टाइम मादे एडे इंजोकल नवाशिल तोले बांग्लादेशर पाब्लिक आरा साहाय्य ताय्य गुज्जे यार फरदायरे इंजोकल दुक्की तो दुगी ओरे बादे आरारे दासे ए मदल लेट्रिन गोसलखाना खाद्य गायरा इम बेगिन दासे टिटा कर दिए तो गामान जो तू गरा से बारिया से देशासे आरा तिन दिले गरा शिल बारिया शिल देशाशिल যারা তো 8 বছর পর্যন্ত রিফিউজি ক্যাম্প মাঝে তা বাজে আজ পর্যন্ত আরার ঘর দেশের মাঝে আরা যাই না পারি আর তো মনে হয় এখন আর দেশের মাঝে আর তো যাই বইলা আর ফোনেটে ফোন না ভরি না পারে সুন্দর করে থাকি না পারে আর ঘর বাড়িলে থাকি না পারে নিলা দুঃখ জিন্দগি তো আর যদি আর হকান দিয়ে যদি আর বর্মার সরহানি নিতে বলে আর দেশের মাঝে আর যাইতাম বই আর এটা বাংলাদেশের মাঝে সেখানে না যাইতাম
জিনাতার বয়স হইলে 18 বছর আই স্কুলত নাযায় দে জুলাইর 4 তারিখ ইদা শুরু দিয়ে দে ইয়ালতি আই স্কুলত নাযায় আর তুগা ইঞ্জিনিয়ারি বনিবাল্লাই স্বপ্ন ছিল যখন 2022 মাঝে বর্মন স্কুলে আঙ্কুলে আর 22 সালে স্কুলে আঙ্কুলে স্কুলে আন্দাত খুশি হই না আই ভর্তি হই আজ জান আশা করি স্বপ্ন দে কেম পুরা করে হাজম বলি আই ক্লাস 7 লতি ফজি এটা মাঝে ভর্তি হই যিনি ইঞ্জিনিয়ারিং আই বনতে চাই এ মেটেরিয়ালি দেখাই দেখাই গড়ি না হারে তুলি তুলি না আর দেখাই না হারে আর বুঝি না হারে সবক দে দিবা আর তো ফারা যাবে আর মাঝে মাঝে স্কুল বেশিরভাগ বন্ধ করে ফেলে বাজেটও কমে যাবে ওই আর বুঝি না হারি আমি পড়ি না পারি আর 3 দিন পরে বাদে ইউনিভার্সিটির মাঝে কলেজের মাঝে ভর্তি বলা ইচ্ছা আসছিল এখন আর সেটা নদীকির এর মানুষের বিয়ার প্রস্তাব দেয় ওর অবিবাহিত মায়া হওয়া তাকি না পারে নির্যাতন করে লই যাইতেছে আর মা বাপেও যখন বিয়ার প্রস্তাব আসে বিয়া দিবলা রাজি গে আর মা বাপ তো এখনো মন দেয় আর ফন্না খাই বলে আর তো ইচ্ছা দেয় এখন ফন্না ফুরি বললাই জিয়ান নাকি স্বপ্ন দেখি কেম ফুরা করি বললাই ইয়ান দল্লা গড়ি না হারি এর অবিবাহিত মায়া হওয়া তাকি না পারে তুলে লই যাবে
I want to become a community leader because I want to change my community and I want to raise awareness for my generation and equal right for my generation and want to stop early marriage and also we want to turn our pain into power and my dream into reality. In this refugee camp, I am facing different kind of challenges and difficulties as you know, no good education system, no good water system and here in the refugee camp is very overcrowded and it's very difficult to spend a life in the refugee camp and most of the people live over the top of the hill and sometimes whenever the rainy season come at that time this landslide happen and die a lot of people. At that time I can't tolerate the pain of death. That's the reason I am raising this voice.
The saying goes, you can't keep doing the same thing and expect a different result. The triple crisis that we've just seen, growing need, declining funding, looming security crisis, needs a new way of thinking, and still changing how we work, especially changing programs, is slow and tough. So I was starting to worry that we wouldn't make the shift in time before everything falls apart. Now I'm feeling a bit more hopeful. Senior UN bureaucrat has started now discussing with us with more seriousness and urgency. Government functionaries who were once very rigid in terms of their approach has started discussing flexible approaches. Political leadership is now more open, and especially the even sideline high level event that happened yesterday at least show me that there is a global resolve to solve this problem, tackle it in its entirety.
So the story says a journey of care. Noor Kolima, age 21, who is a Rohingya girl born in 2004 in a small village of the Myanmar. She was living with her parents in Myanmar, in a family of seven, with her parents and five siblings. She attended school up to 5 in Myanmar in a government school. So back in 2017, when the violence started in the Myanmar, Noor and her family was forced to flee from the Myanmar to Bangladesh. Despite the trauma and the displacement, Noor was determined to support the community. So in 2022, Noor started working as a community health volunteer with the health and nutrition program of BRAC. She got the training of basic health emergencies covering the essential topics like the maternal and child health care, disease prevention, and communication skills. Noor started conducting the household visits where she disseminated important health-related messages, built strong relationship with the community members, building trust, and taking the community awareness session. One day, during a household visit, Noor met an woman named Shofika, 33 years woman of 5 children. During the discussion of the family planning, Shofika shared that she has a concern of missed period. Noor immediately took her to the health facility. After the lab investigation, it was confirmed that Shofika is pregnant again. Noor didn't stop there. Noor make her accompanied and introduced her with the midwife so that Shofika can get all the services that is necessary during the maternity period. And fine morning of August 11, 2025, around 6:30 a.m., Noor Kolima got a call from Shofika. So Noor rushed away immediately to her house and accompanied her to the health facility, BRAC health facility, where after trying of the medical service providers, Shofika was able to give birth to a healthy baby boy after 7 hours of trial. And Noor Kolima was always accompanying her throughout this journey. After 2 days, Shofika left the health facility with a heart full of gratitude to the health service providers and obviously to Noor Kolima. After all this, Noor says, this was one of the most rewarding experience of my life, helping a mother delivering a healthy baby throughout her delivery journey. That's why I became a community health worker. So this is the hope I get every day while working with these people and while working with this community.
So when this crisis began, we were a little hesitant whether we should get engaged, whether we have the capacity to do it, and so on. And the scale was overwhelming. We sent a small team, and the team came back and presented a horrible story of crisis, devastation, death. So we talked with our founder, Sarabed, at that time, and he said, don't wait, go do whatever you can, because BRAC is about helping people in need. So, and also the board approved the first $10 million US from our own fund to the crisis. And so we knew, if we didn't act fast, the Rohingya community would suffer, but more also critically, 35 years of work that BRAC has done in Cox's Bazar will be undone. So our first team after the scouting mission went within 4 days, led by the then executive director of BRAC. I was part of the team. Akram Bhai was also part of the team. And we were really stunned. We had no idea, even the 4 days between the first scouting mission and our mission, the situation deteriorated drastically. It escalated so fast. And we realized we needed boots on the ground first. That's the first order of business. So at 4 p.m., almost the end of the office hour, we called our offices in all 64 districts and told them that, please release whoever is willing to come to Cox's Bazar from their respective duty in their offices. And, from the next day, almost noon, people started pouring in from different districts of Bangladesh. Approximately 400 staff reported, some after doing 14 hours of bus journey. They just came down to Cox's Bazar, reported for duty. So and I was quite new those days in BRAC, so I asked why. And I realized this is exactly in BRAC's DNA. We show up, we act, we care. That's BRAC. And we didn't have proper, places for them to stay. We never planned for 400 people. Some colleagues told me afterwards that they knocked on doors in the rain in neighborhood and basically asking, can we have a dry place to sleep? And some actually slept in a stable. Though BRAC is an international NGO, we started in Bangladesh. We are a Bangladesh-based NGO. So as the crisis drags on, more and more global actors are shifting their focus to new theaters like in Ukraine and other crises. We realized we are here to stay. We have to stay. It's our responsibility. The Rohingya and the host community still need us, and as long as they need us, we cannot go anywhere else.
BRAC has been able to support almost 1.3 million people in 2024. That's just staggering if you think about that. And this is across both the Rohingya and the nearby, what we say as host communities, and which represents all 33 camps that we work in. And we provide services for education, water and sanitation, health and nutrition, child protection, shelter and site development, food security, livelihood, skills development. And again, this gets at the BRAC way, where we try not to run pillar programs. So even if donors support pillars, we try to integrate that so at the level of the client or the person that we're serving, it can feel like a holistic service.
So now we are seeing a rise in non-communicable and communicable disease pattern over the year, and mental health need is increasing. Almost 61% of the population are currently requiring the mental health needs. Access is still barrier for almost 22% of people. Immunization gap is still persisting. 22% of children are totally not fully immunized in the camp. But still, the health service has been improved a lot over the year, because almost nearly about 50% of female currently want their children to be born and in the health facility rather in the home. And obviously, we have reached to that point after 8 years where we can say that health system is working good in the Rohingya camps, and this could not be happen without the donors who are continuously supporting us for reaching at this level.
So we have been pushing our thoughts and ideas that we really need to work more integrated approaches, not just silo sectoral approaches. We need to bring the sectors closely, to have a maximize the outcome and synergies among themselves. WASH and health doesn't talk with each other because they have a very sectoral process. But if you look into these hygiene issues, if you don't give a hygiene education, your health problem will remain there. You really just can't build your toilets and tube wells and then just come out from there. You really need to work together with your health facilities where these diarrheal cases, patients are coming in. Go back and fix these problems with the sanitation one. So you need to really work with these two teams. It's a hugely densely populated camps. It really can't. Living conditions really poor. A single family uses only single houses, one room for a family. Can you imagine it? It's teenage boys and girls share the same rooms. there's no space for the new, households. This year also added another 125,000 Rohingya people.
And I also want to recognize amongst us a frontline worker, Mohammed Rafiq, in the chat. You've identified some really important points on what's working well in the camps. I don't know if you can go off mute or if you'd like to intervene.
Okay, first of all, thank you so much for giving me this opportunity to express the home office on the refugee survey. I have been working as a community para counselor. It's been 7 years gone, and also I still continue. So I would like to express something about the crisis of the Rohingya refugee children. Especially recently, the UNICEF closed the learning center. For that reason, most of the Rohingya children isolated and also depressed and also hopeless and helpless. And they can get any safe space and also can find any healing place. And also many types of challenges they face. Apart from the older people and also youth. So is there any option? Is there any opportunity for the children to provide the administrative support, specifically the children who can't attend the LC learning center?
And it's so cost effective to keep a child in the school. You just need $80. With $80 per head, you can keep a child in school for a year. So one thing that we can all do is really keep this issue alive, help the government, the people who has the power, to keep them aware that, look, there is more than 1.2 million people anguishing in Bangladesh who doesn't have enough to go by. And Bangladesh is a country which is not among the wealthy countries. While the water crisis in the camp is critical, the same crisis exists in the nearby host community because they share the same water table. So keeping this issue alive, asking those who have power to do something about it is, I think, also critically important.
Being able to highlight that there are practical ways forward, that whilst there are challenges, there are solutions. And, and in particular, there are definite, like we're saying, whether it be UNICEF and advocating and following that conversation about extending education, or it be on food aid, like those are some of the principles that really do change the cost of delivery per household. And so as much as we can each individually join those conversations, share stories of success, because there are solutions that are working, and encourage those workers that are on the front lines as much as we can.
In the 17, 18, 19, the camp was really dry, the no trees. But if you go there, it's green. The trees are there, the vegetable gardens are there. Every household, if they have a small piece of land in front of the door, they have now a vegetables there. So I think if you see the power of the people, the utilization of the resources, that whatever they have it, so you can see this grant. So that's remind me every day that's how powerful this population is.
We do development differently. For example, we are talking about falling cost, we're talking about cohesion and so on, but we're not sitting idle. We're doing three things I must mention. One is, Akram Bhai talked about we started a project with EU to deliver the services completely in a different manner, where you reduce the cost drastically, but improve the accountability mechanism and involve the Rohingyas, as a key delivery agent. The community-led development that BRAC practices, we're trying to do it. And Akram Bhai said, we're very happy that government and UNHCR and EU agreed us trying to do that. that reduces the cost. Second thing that we are doing effective what you call localization. BRAC is helping 27 other national NGOs, smaller NGOs, to deliver the service. So we provide them we actually offer the risk management services to the donors. So the donors give money to us, and through us, 27 NGOs are working, and they're delivering services at a much, much lower, like all Bangladeshi NGOs deliver 30 to 40% lower cost than what you have the international actors services. And we are really, really trying to push the livelihood as a viable option, both the policy level, but also, as you know, for example, we have people working in the camp, and the product that they produce are being sold at our stores outside the camp. We recently opened Arong, the largest lifestyle brand in Bangladesh, a store in Cox's Bazar. So in Cox's Bazar, you can find a Rohingya corner where the Rohingya arts and crafts are being sold. So we are trying to go all out to give them also this is about a question of dignity. Why would you fully depend on, relief when you can work and you can earn? As in BRAC, we talk about turning camp into community. Camp has this own derogatory, vibe with it. You don't go for encampment, you create communities.
Yeah.
And that's, as a developing organization, that comes naturally to BRAC. And that's what we're trying to do in BRAC, and that I'm really proud of.